Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action. My name is Nina Sun, and I am an associate editor for the SRHM Journal.
Good morning, good afternoon, good evening, everyone who is listening to this podcast. I'm Esther Kishmödi. I am the Chief Executive of Sexual and Reproductive Health Matters. And today we are talking about the political impact and an everyday impact of political decisions, especially in relation to the funding cuts of PEPFAR and USAID funding as it affects trans and gender diverse communities around the world. I'm very, very pleased to welcome here today our guests, Anil Padavatan, who is the health lead at Global Action for Trans Equality, or GATE, based in South Africa. Hello, Anil. Also warmly welcoming Amanita Calderón-Cifuentes, who is the HIV Research and Advocacy Officer at Trans Europe and Central Asia, TGU, based in Germany. Hello, Amanita.
Hi, Esther. How are you?
I'm great. Thank you so much for being here. And Adrian Kibe, who is the program consultant at the East Africa Trans Health Advocacy Network, ETAN, based in Kenya. Hello, Adrian.
Hello.
Hi. So let me turn to you first, Anil, and then Amanita and Adrian. Can you please talk about the nature of these cuts and how they are affecting trans communities and gender diverse communities worldwide?
So, hi, Esther. Thanks so much. It's great to be speaking to you today. In terms of how it's impacting the trans and gender diverse community, it is a crisis, and it's a far-reaching crisis. So USAID and PEPFAR funding has for many decades supported community-led organizations that are providing essential services for HIV and STI prevention, treatment, care, hormone therapy for adults, and mental health support. But these clinics don't only provide medical care, they're safe spaces. And they're safe spaces for a community that is disproportionately impacted by HIV and who also experience systemic stigma, violence, discrimination, criminalization. And these clinics all provide really vital access points for community members who face serious barriers in accessing care. So it's a massive catastrophe. Obviously, these funding cuts have impacted HIV programs around the world, as well as other health responses. It's not just HIV funding. And because donors don't like to duplicate funding, this means that we've now got kind of huge gaps in national HIV responses. And these are particularly in data collection and surveillance, and in prevention services, and in services aimed at key populations. But in these funding cuts, some organizations and countries have now received letters informing them that their funding will be reinstated. So at the moment where we are now, we are not sure how many HIV programs will still be able to continue. But we do know for certain that the funding for trans and gender diverse specific programming is not going to be continuing. We know that funding is cut.
Thank you, Anil. So, Adrian, we hear everyday news. It's in our life in terms of hearing day by day the devastating impact in Africa. Can you please tell us more what's happening in your region and in specific countries? How is it affecting differently countries, differently communities across Africa?
Thank you, Esther. So for many who are listening in might not know, but a number of Eastern African countries have criminalized LGBTQ persons, and that means that there's no legal recognition for transgender persons. And so for many of these persons, the hub has been in health. The entry point has always been in health. And by this, we mean through the HIV programming. And so we, as a result of USAID and PEPFAR funding, we've seen that there were drop-in centers, what we call DICEs, and clinics that were established to cater for the needs of LGBTQ persons or key populations, which includes transgender persons. And so with these cuts, that has meant that these clinics, these drop-in centers, have ceased to function. Anil was putting means that there's no safe space for these persons, but additionally, it means that there's no place to access these services. The way to go now is to go to general public hospitals. And what this would mean for a trans person is that they might be targeted, they might be violated, they might also be denied services. We're also seeing that advocacy efforts are also going to go on a minimum or on a low. And this is because of the pronouncements that have been made as a result of these cuts. We have seen several heads of state try to align themselves with the US in order to see if they'll be reinstated or such. But what this consequently means is that there is increased surveillance. Now they're looking out. They want to see who these people are. And what now this means legally is that in countries like Uganda, where we have the Anti-Homosexuality Act, this is now, it's not taking off completely. They're going to be extremely strict. In countries like Kenya, where we have proposed bills, one called the Family Protection Bill, which is basically just like the Anti-Homosexuality Act or bill in Uganda. So we are seeing a potential that these things might now come into being, they might become law, and ultimately completely trying to annihilate trans persons.
Thank you. Amanita, when we come to Europe, we are not entirely clear and informed that how these funding cuts, political decisions are affecting Europe, how the European politics is responsive to this. Can you please tell a little bit about that?
Yes, Esther. So let me start by saying that this whole situation is directly challenging the EU's core values, right? Human dignity, equality, solidarity, the commitment to ensure access to healthcare for all. So from a starting point, these funding cuts are diminishing the goals and the ways of living in Europe. If you specifically extrapolate this into the lives of trans people here in the region, what we're seeing is that several trans-led organizations are being and experiencing funding disruptions, severe funding disruptions. And this is affecting not just access to HIV-related service settings, but also is like a lot of legal aid, mental health support, safe community spaces are disappearing. And the reason why this is so important is the same reasons why the principles and values of the EU are often quite represented in spaces like the United Nations, because targeting trans-specific health, including the increasing risk of contracting HIV, it's also a matter of human rights. So when we get defunded on all of these different spaces that are being left out by not having the fundings from PEPFAR or from USAID, then we're not just targeting specifically access to the HIV continuum of care, we're diminishing all the access to human rights that allows the trans communities to adhere to treatment, to become active members of the society and to take care of themselves. That's the situation in Europe, and it's quite daring.
As you pointed out, Anil, I mean, legal gender recognition, discrimination based on gender identity, and has been under development, especially in the past 20 years. But these HIV programs and access to health services was a safe place to rely on, whether it comes to key populations on the basis of non-discrimination accessing healthcare. Can you tell a little bit more in terms of how these programs are now failing and falling, and how do you experience, you have been doing some research that you mentioned, what your research is showing?
Thanks, Esther. So yes, in terms of the impact on clinics worldwide, the data that we've got at the moment is that there are 46 clinics that are at immediate risk of shutting down, that have lost to 95% of their funding. Some clinics have already closed, and some are dramatically scaling back their services. And this is putting access to HIV care and prevention services out of reach of thousands of people. And this is in the age of effective ARV treatment and increasingly effective prevention. We never thought we would be here again, but we are really facing the situation where we might have thousands of people getting sick and starting to die of AIDS again. And that's truly horrific. It's also obviously the impact goes a lot beyond just healthcare, because when you've got this kind of burden then falling onto already fragile health systems, it has a big impact in terms of security in countries and stability in countries. And that then has a ripple effect. And that was going to have a massive effect on countries in regions that can least afford this kind of catastrophe. Thank you.
Thank you. Adrian, when we were conversing before, one of the arguments that is coming up that primary responsibility should be on the states and the governments to be accountable to provide services for their population. However, we know that this funding aid cut is not affecting each country in a similar way, and some countries are relying more on aid in terms of provision of services than others. You also pointed out that the provision of HIV services, identifying trans and gender populations, sex workers, and others were protected under key population programs. How is the diversity of this funding? How this state accountability versus relying on aid is playing out on a daily life now with these funding cuts across Africa and especially in East Africa?
Thank you. Yes, we've had a lot of arguments come in that a state should be able to provide for their constituents' health. However, there's a clear indication that, especially in Eastern African countries, there is a clear gap. And the reasons to which this gap is there is a conversation that ought to be had on an individual country basis. However, what we know now is that lives are at stake. What we know now is that people's health is jeopardized. And so I don't think these arguments at this particular point are not really very helpful. We might go back and forth on whether it is right or not, but at the end of the day, the fact is there are people that are dying. There are people whose livelihoods have been lost. And the people who bear the greatest risk are key populations. And at that, we have transgender persons. And ultimately, all other LGBTQ persons will also suffer as a result.
Amanita, can we talk a little bit about trans communities in Israel and Central Asia? What their needs and health protection and well-being is particularly important when you look at the context of Europe and this politics, how this politics plays out vis-a-vis Europe and USA and PEPFAR.
So Esther, the thing is, Eastern Europe and Central Asia is the second region in the world after the sub-Saharan African region that has an increasing trend of new HIV infections and increasing trend of HIV-related deaths. This is something that we're not really seeing anywhere else in the world other than the EECA region and sub-Saharan Africa. And because of this reason, these two parts of the world need a special protections and special investment and special work, right? As it is right now, in the EECA region, we are experiencing several funding cuts that are causing, well, actually, already several deaths. The latest report from UNAIDS indicates that more than 200,000 people globally have already started dying. Like this is already a reality. People is already dead. Hundreds of thousands of people is already dead. Now, specifically in the EECA region, I'm going to include some countries from Central Europe too. I would like to highlight Ukraine, for example, is about to run out of medications just in a matter of days and weeks. And I know that is the same case for 7 other countries in Africa, but I will let Adrian talk about that more if you know a little bit more. I can also tell you that we have experienced losses between tens of thousands to hundreds of thousands, with some clinics on the edge of closing. If it wouldn't be for the advocacy done by TGU, by GATE, and by many other organizations, places that are service providers that I'm not going to name because they are in countries where just the provision for key populations, including trans people, means that you can be politically targeted. So these clinics depend entirely on funding that's coming from the United States and not specifically from Europe. So that is quite concerning. I would like to specifically talk about the cases of Tajikistan and some countries and some other countries in Central Asia, because Tajikistan, Uzbekistan, and Kyrgyzstan have very few service providers that are specifically targeting key populations, trans and queer communities, mainly because they don't even recognize the existence of the trans communities. So some of these countries, trans people do not exist. There's no trans people in places like Almaty, for example, or in Kyrgyzstan. And for this reason, the funding cuts are especially concerning. I can tell you more numbers without a doubt, but I think that this just paints the general picture of the situation in the ECA region.
When it comes to politics, it's not only the funding cut. It's devastating enough. But trans communities are being attacked by other different political actions, executive orders that is directly targeting gender diverse populations. Can we talk about it? How is it targetful to trans and gender population, but how it goes beyond the nature of these political orders, the nature of the impact, how it also goes beyond trans populations, why targeting trans populations specifically as well?
So I think one of the big frustrations has been that there was a roadmap for greater domestic funding of the HIV response. So there was a whole process in place that was being coordinated through UNAIDS to try to get countries to step in and provide greater domestic funding for the HIV response. But instead of doing this in an orderly fashion, we've had these dramatic cuts happening suddenly. And now other donors, other major international donors threatening to cut their funding as well. So it's having a domino effect. And because it was introduced with a huge amount of transphobic rhetoric, what we're seeing is that this is fueling an anti-human rights and an anti-gender narrative that we've been seeing groups that are funded, receiving large amounts of funding from anti-rights groups in the global north that have been acting in countries around the world and producing these anti-rights and anti-gender narratives. And this is just feeding into that. And we're actually seeing major reverses of human rights gains. We're already around the world, and Amanita and Adrian will be able to talk more about this. We're seeing hate crimes spiking against trans and gender diverse people. This is a setback in human rights, but when the rights, particularly health rights of one group, are attacked, it doesn't stop with that group. And the thing that's really concerning is that these anti-gender rhetorics, they come in with a heavy focus on the trans and gender diverse community, but we're not actually their ultimate target. They're actually targeting women's sexual and reproductive rights and gender equality generally. We're just the very divisive issue that gets a lot of attention, and we make it socially acceptable to limit people's health rights. But actually, this is impacting on everyone in society, because when human rights are eroded, it impacts on everyone, and particularly on vulnerable women and girls. Thanks so much.
Adrian, how does it play out in Africa? There are incredible gains. Yes. Can I just ask specifically, because we need to see the gains. The past 20 years showed gains. There were beautiful laws enacted. There were constitutional protections in some countries. In other countries, as you say, their criminalization remained. But this organized anti-gender politics is shaking up completely the human rights movements, the health movements that have been developing both regionally and in specific countries. Can you talk about this broader impact, Adrian?
Yeah, thank you. So to understand this, we must first look at how much money Africa is getting in terms of foreign aid. And Africa we get around 60 billion US dollars in terms of funding. 40% of that goes to healthcare programs, of which now some of it goes to HIV, maternal health. We're talking about tuberculosis and malaria, things like that. So most of what USAID is giving and PEPFAR goes to some of that as well. So with these cuts, what people don't understand is ultimately your access to malaria medication is going to be affected. Access to tuberculosis medication is going to be affected. Tuberculosis testing itself is going to be affected, right? And these are things that affect every other person. Then now we go to maternal health care. When this is limited, the first place they'll start is maternal health care. And we're already seeing serious deaths from because of pregnancies and things like that. And so I agree with Anil that we might actually be starting with trans persons, but ultimately the goal is to get to women, and we are slowly getting there. We are already seeing in Kenya, there's been serious, I think there was like 12,000 and something deaths in just a single year. And they were saying that the state itself is unable to take care of women who say they lose a baby or things like that, or there are complications with the pregnancy. We're seeing women die as a result. There's also the fact that when you look at the HIV programming, much as they say that trans persons are the ones who are not, they're going to limit the access for trans persons, it's a fact that all other LGBTQ persons are going to be affected, especially in countries where they're criminalized. That's Kenya, Uganda, most of the countries where the criminalization is happening, the protection is happening through the Ministry of Health, that is now gone. Lastly, USAID was also responsible for organizations that worked with LGBTQ refugees. In Kenya, we receive a number of refugees from Uganda, Rwanda, Tanzania, as the conditions there continue being hostile. Kenya, just last year, said that they would not be taking in any more LGBTQ refugees. But there are already refugees in Kenya, and they are getting assistance through organizations such as HIAS. So we have HIAS had a staff dedicated to working on LGBTQ refugees. The staff was done away with because of the funding by USA. So there's different aspects that actually are touched on that many of us are not talking about. People think that it's about trans people, and some would celebrate because they believe whatever they believe, but ultimately it will go back to you. It will bite you who thinks it's not going to get to you, because cisgendered men in Africa are getting malaria, so they will die if there are no medications. These medications are coming from this funding. And we could also say that African countries should be able to provide this, but there's a reason why the aid existed. Countries have been unable to do this. They have been unable to take charge, to put policies in place. And so we can go on and on, but ultimately everyone will be affected by these cuts.
Amanita?
Let me just to add, before I continue, but let me just to add to Adrian. Yes, everyone will be affected, because also this virus will mutate and it will become resistant to medication. And take a wild guess, who are the sexual partners of trans people? It's not just other trans people. It's cisgender people. It's cisgender heterosexual men. It's cisgender women. So yeah, limiting access to HIV prevention services or to HIV treatment to trans people will affect everyone sooner or later. But it goes further than that. As Anil was saying, coming after a population that is less than 1% of the planet is not just criminal and petty, but it's also strategic. It's devising. It's the existence of trans people is something that has caused so much debate between the rest of the world that it was just such an easy political strategy to tap into power and then just divide populations. The issue is we live in syndemics and the populations are not segregated. Trans people is not something that, like, we're not far away from everything, The trans communities intersect with the sex worker communities and with the people that use drugs and with the queer communities and with the cisgender heterosexual communities. My partner is a cisgender heterosexual man. Quite often, there is a constant interaction between us. And because of that reason, if you start taking away the human rights of one population, or if you start targeting these populations by cutting them off from services that are completely necessary for us to be able to have mental and physical well-being, then what's going to happen is that the other communities are going to continue being affected. And a simple example of that is how, for example, one of the biggest, the population that is being affected the most after trans people, when there's laws not allowing trans people entering the bathroom of our gender identities, but of our sex assigned at the time of birth. The main affected is cisgender women after us. So many cisgender women that are being perceived as trans women by men are being attacked, are getting fired, are being targeted because of these ridiculous transphobic laws. And it will not stop there. It will come to every single other population. So it's strategic, it's quite concerning. They're feeding on people's fear, ignorance, and hate, and they're also cutting us off. Now, the thing that they don't understand, and I will close this intervention with this, is you can defund us, you can kill us, you can do whatever you want, but we will be born again. We will continue being born because these gender heterosexual people are our parents. As a trans woman, I am choosing not to have children, but I can tell you, my mom it's super straight and super cisgender. All of us will continue raising up. There's no way to eradicate the trans communities. It's just simply not possible. And we will continue coming back stronger and more beautiful every time.
Thank you so much. So this is not optional. Eliminating sexual and reproductive health and rights, eliminating populations, it is not optional. They can try as hard as possible. So resilience is one strategy that is required. But strategies in order to create new programs, new strategies, new ways of thinking, doing, new coalitions, new partnerships is another way to go. It might be too early, you may not want to talk about, but what is the way forward? Where do you get your energy from? How do you do things differently? What the options are there? It's very early on. We are in April. The huge attack started in January, although it has been there for a long, long time. What strategies you are relying on? What is your thinking? What are your new coalitions and ways of working and going forward?
We are a very resilient community. We've always been here and we will continue to be here. And we've always been in the forefront of the various movements to protect and promote human rights. We're in the forefront of this again, but this is not something where it's our battle alone and we can do this alone. This is something where we really need a broad response. We need movements to come together and we need donors and anyone who is able to provide support to step up. This is really the time that we desperately, desperately need funders to step up. At GATE, we have been looking at how we can help and to support and strengthen our movement. And one of the things that we're doing in collaboration with our partner organizations is that we're initiating an innovation hub. We've got an innovative project where we are looking at how we can support, mentor, direct investments towards organizations that are developing alternative funding models to try and improve the resilience and this financial sustainability of our movement. And so we've got a program going. We've got some organizations that have already taken quite big steps in terms of very innovative approaches to alternative funding models. And we're looking at how that can be rolled out more broadly. And we're working in very close collaboration with our partner organizations around the world. If anyone wants to know more about the Innovation Hub, they can go to our website and have a look. Our website address is www.gate.org, and you can read more about that. But Amanita and Adrian will be able to tell you a bit more about what organizations in their regions are doing. Thanks.
Adrian, what are your strategies? What are your thinking? I'm also like a lot of organizations, both international organization or national organization in Kenya, whether they are human rights or service provider organizations, are being attacked, threatened, and many of them are refusing to apply with certain level of gag rules or stepping away from communities whom they have been working with a long time. What are the strategies you are applying? How you are going forward in these situations? What are the national, international, regional dynamics that you are relying on?
Right, thank you. So the times are very difficult. In East Africa, there is heavy hesitation by, if it's government or even civil society actors, to associate the trans persons with trans issues. And so what we are trying to do as Ethan is, one is to strengthen our membership. And a way to do that is we are working with like-minded civil society actors, those that are pro-trans rights, all that. So we're working closely with them so that they are able to advocate for our issues in rooms that we cannot enter. That's the first. So we're collaborating with civil society. We're also collaborating heavily with feminist movements. At this particular time, there are some feminist movements that have already drawn the line and are anti-trans. So we're finding the ones that are like-minded, and we're working through the issues together. So for example, in Kenya, we have a problem of femicide. You will see Ethan taking part in all the activities that are planned with regards to that. So what that does is, ultimately, if we're with women groups, we're with civil society actors talking about mainstream human rights or all other issues, then we are also in their minds, and we're also on their tongue. So they're able to advocate and push for us at the same time. Aside from that, Ethan, being a membership organization with over 40 organizations in the Eastern Africa region, we also respond to emergencies. But now with these cuts of funding, it is becoming extremely difficult to come in, despite the fact that the emergencies are more than ever. And so what we have done is we have tried to diversify our sources of funding. We are crowdfunding at the same time. So we have a link for people to donate, and this money is mainly used for emergencies. Any emergency that comes out in Rwanda, we're the ones who respond, Uganda, and the idea is to respond to emergencies not only for our members. So those are some of the things we're doing to get by during these times. And yes, those listening can also go to our website and check out what we have there. The link to the crowdfunding is on Donate. So just go to www.ethan. Ethan is EATHAM.org. Thank you.
Thank you. Amanita, what kind of strategies in Europe you can rely on?
Okay, so I'm going to talk about from the strategies that funders, including private sector and governments, can go for. I'm going to talk about allies and human rights organizations, and I'm going to talk about the movement itself. So let's start with funders. Especially within the EU, we need commitment to long-term, flexible, and core funding for trans-led organizations. There's no doubt about that. Emergency support is not enough. Right now, as things are, we need groups to be able to provide vital health, legal, and mental health services, because otherwise we will not have the infrastructure necessary to take care of ourselves. Now, if you check DGU's policy brief at dgu.org, you will be able to see that we are calling for the EU to increase funding for community-led integrated healthcare services and initiatives. What is this? These are services that bring everything within the HIV continuum of care, whether it is HIV prevention, testing, treatment, etc., to trans-specific healthcare, harm reduction programs, mental health and reproductive programs, and anything that is specifically providing the services that cover the biomedical needs of the key populations, whether it is trans people, sex workers, people that use drugs, people in prison settings, and men that have sex with men. This is really important because this will allow to optimize the very little money that we have at the moment. Now, the governments have to integrate these community-led integrated models into national systems. It's not just enough to put some money into it. No, we need an EU HIV strategy that is focused on protecting and funding this type of community-led integrated services. Now, on the other hand, for allies and human rights organizations, we really have to strengthen our coalitions. We have to share our resources, amplify trans leadership within those other organizations. This is a moment that is where solidarity is going to be crucial. Finally, for the movement, I want to remind ourselves something that Audre Lorde taught us, and that is self-care is political warfare. Self-care is not just waking up in the morning and having a face mask and looking at the mirror and be like, you are pretty. No, it is really important to remember that self-care is a privilege that only those that are not oppressed have access to. So choosing to protect your mental health and remembering that community care and collective care are fundamental parts of self-care and vice versa, it's something that we need to remember as much as possible. I rely 100% on my community to borrow money, to talk about my issues and my sadness and my pain and my fears, but also to build networks of support that can potentially lead to radical changes. And with this, I'm going to end, and that's an invitation to the rest of the community outside of the trans community, and is that people have to understand that the reason why we're targeted with so much hate and fear is because we represent a mirror. We are a mirror to a wound that they have, a wound left by gender norms that have created cages where no one can fit. No man, no cisgender men, no cisgender women can fit on the ideas of masculinity and femininity. If we start deconstructing all of these cages, all of these gender norms by the hand of trans communities, we will actually might be able to have a radical change that will benefit everyone in here. Thank you.
Thank you so much, Amanita, Adrian, Anil. I really, really appreciate for this conversation. We are extremely pleased and proud and enjoying, and it's our core value of working together, and really looking forward to continue our collaboration. And thank you so much for sharing your opinion, expertise, and looking forward for collaboration. And I wish you all the very best, and together we will make a difference. Thank you so much. Really appreciate, and all the best.
Thank you so much for the invitation, Esther.
Thanks so much, Esther, and thanks to all of your team.
Thank you.
Thank you, Jessica. Thank you, everyone.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.